Welcome to America's Fractured Politics. I'm your host, Mark Mansour. Today, we're taking a hard look at one of the most controversial and consequential chapters in American public health, the tenure of Robert F. Kennedy, Jr. as Secretary of Health and Human Services. In just 4 months, Kennedy has set in motion a transformation that is upending the mission of America's public health agencies and challenging the very meaning of public health itself. What's happening isn't reform, it's an aggressive ideological overhaul with implications that are immediate, far-reaching, and some would argue catastrophic. To understand how we arrived at this moment, we need to look at Kennedy's path, a journey as complex as it is controversial. Born into one of America's most storied political dynasties, Robert F. Kennedy is the son of former Attorney General and Senator Robert F. Kennedy and nephew of President John F. Kennedy. His early years were marked by both privilege and tragedy. He attended Harvard, then the London School of Economics, and later earned a law degree from the University of Virginia. Kennedy's early career was defined by environmental activism. As a young attorney, he made a name for himself by fighting corporate polluters and advocating for clean water, most notably through his work with the Hudson Riverkeeper and the Natural Resources Defense Council. However, his life was also marked by personal struggle. In the 1980s, he battled heroin addiction, an experience that, by his own account, shaped his distrust of authority and his belief in redemption and second chances. By the late 1990s and early 2000s, Kennedy's focus began to shift. He became increasingly vocal about his skepticism of vaccines, publishing articles and giving speeches that questioned the safety and necessity of childhood immunizations. He founded Children's Health Defense, an organization that would become a major hub for anti-vaccine activism. For years, Kennedy was dismissed by much of the scientific and medical establishment as a fringe figure, but he was also a skilled communicator, able to tap into a growing current of distrust in government, big pharma, and scientific elites. He cultivated relationships with celebrities, politicians, and grassroots activists, building a coalition that, while often marginalized, was fiercely devoted. During the COVID-19 pandemic, Kennedy's message found a much larger audience. As public anxiety soared and misinformation spread online, his warnings about vaccine safety and government overreach resonated with millions of Americans. He became a regular presence on cable news, podcasts, and social media, positioning himself as a champion of medical freedom. In 2024, Kennedy launched an independent campaign for president. While he ultimately failed to gain significant traction, his campaign drew enough support to influence the national conversation, and crucially to catch the attention of Donald Trump. In a move that stunned both supporters and critics, Trump offered Kennedy the position of Secretary of Health and Human Services. Kennedy accepted, and in January 2025, he was sworn in. From his first days in office, Kennedy moved with extraordinary speed and determination. He asserted direct control over the FDA, the CDC, the NIH, and the Centers for Medicare and Medicaid Services, agencies that for decades have been the backbone of American public health. Kennedy's goal was not to make these agencies more efficient or accountable. Instead, he made it clear that he saw them as corrupt extensions of the pharmaceutical industry and government overreach. His first budget proposal was a shock to the system, a 30% cut to the CDC's immunization and emergency preparedness programs. This came at a time when infectious diseases, like measles, were making a comeback, and public health officials were still recovering from the exhaustion and burnout of the pandemic years. Kennedy didn't stop there. He ordered a full review of all vaccine approval and recommendation processes, halting schedule updates to the childhood immunization schedule, and freezing funding for COVID-19 booster procurement. At the FDA, Kennedy suspended new hiring in the Center for Drug Evaluation and Research, pending a conflict of interest audit. He directed the agency to cancel all public-private partnerships unless personally approved by his office, and instructed legal staff to review past drug approvals, where FDA officials later took jobs in industry. On the surface, these actions might look like a push for more ethics and transparency, but in practice, they have ground the approval pipeline to a halt. Dozens of new drug applications are now months behind schedule, and patient advocacy groups are raising alarms about delays in treatment for rare diseases, cancer therapies, and even routine generics. Perhaps most alarming has been Kennedy's personal intervention in CDC communications. He replaced key communication staff with longtime allies from anti-vaccine and medical freedom movements, and his Surgeon General choice never finished her medical residency. Internal guidance now bars CDC officials from making public statements about vaccine efficacy, mask use, or school-based immunization programs without clearance from the Secretary's office. One senior CDC epidemiologist, speaking anonymously, described the environment as, quote, paralyzed by fear and ideological surveillance, unquote. The agency's long-planned measles eradication campaign, which was due to launch this spring, has been indefinitely shelved. Kennedy has also taken aim at the NIH. In February, he froze all new intramural research, grants, and ordered a top-down review of NIH-funded vaccine studies. While claiming to root out corruption and groupthink, Kennedy has decimated the ability of the nation's premier research institution to plan long-term scientific projects. International collaborations have quietly stalled, and some have been stopped entirely. Young scientists are leaving for private industry or foreign institutions. Several top researchers at the National Institute of Allergy and Infectious Diseases have resigned, citing political interference and intimidation. Kennedy has said the NIH took a years-long pause from funding infectious disease research. In November 2023, he told an anti-vaccine group, "I'm going to say to NIH scientists, God bless you all. Thank you for public service. We're going to give infectious diseases a break for about 8 years." Researchers whose funding was stripped said they've stopped clinical trials and other work on improving care for people with HIV, reducing vaping and smoking rates among LGBTQ plus teens and young adults, and increasing vaccination rates for young children. Several weeks ago, Kennedy made awful headlines again by firing all 17 members of the CDC's Advisory Committee on Immunization Practices, or ACIP. This committee is responsible for making recommendations on the safety, efficacy, and clinical need of vaccines, decisions that have a direct impact on what vaccines are available to Americans and when. Insurance companies are required to cover vaccines endorsed by this committee, so its recommendations carry enormous weight. Kennedy justified the purge by saying it was necessary to restore public confidence in vaccines and to ensure that quote-unquote unbiased science, evaluated through a transparent process and insulated from conflicts of interest, guides the recommendations of our health agencies. He criticized the previous committee for being, quote, plagued with persistent conflicts of interest, unquote, though the evidence he cited was from a 2009 report and subsequent evaluations found that most disclosure forms had minor inaccuracies, not significant conflicts. This sweeping move drew immediate and forceful condemnation from the scientific and medical communities. Paul Offit, a former ACIP member and one of the developers of the rotavirus vaccine, said, "They should be given an award, not fired." Offit, a pediatric infectious diseases specialist at Children's Hospital of Philadelphia, added, "RFK Jr. has for 20 years shown you who he is, and nothing has happened since he's been Secretary of HHS to make you feel any differently." Tom Frieden, former CDC director, issued a stark warning. "We'll look back at this as a grave mistake that sacrificed decades of scientific rigor, undermined public trust, and opened the door for fringe theories rather than facts to guide the recommendations that doctors rely on to protect patients." Lawrence Gostin, a professor of public health law at Georgetown University, echoed these concerns, telling CNBC, "Instead of restoring public confidence, these actions are merely politicizing science and vaccination policy. I find it difficult to see how this can be trusted anymore." Gostin and other experts warn that Kennedy's decisions jeopardize scientific integrity, disturbs a respected regulatory framework, and could amplify public skepticism toward both vaccinations and federal health agencies, including HHS itself. Dr. Neil Mann, a health professor at Northeastern University, put it bluntly. It is crucial to understand that these actions have far-reaching implications for everyone. This is not merely a committee being disbanded. It is a committee whose work influences public health at large. The Infectious Diseases Society of America also responded, with spokesperson Dr. Tan refuting Kennedy's claims of conflict of interest as entirely unfounded and warning that his actions could have serious negative consequences for Americans of all ages. Doctors for America, a national nonprofit representing thousands of physicians, called for Kennedy's immediate resignation or removal. In a statement, they said, Robert F. Kennedy Jr. is unfit to serve as Health and Human Services Secretary. Since taking office, he has used his position to advance health misinformation, dismantle public health services, and undermine HHS's mission to enhance the health and well-being of all Americans. They criticized Kennedy's failure to endorse evidence-based medicine amidst a growing measles outbreak and condemned his public statements that downplayed the outbreak's severity and promoted unproven remedies like cod liver oil. The group warned that Kennedy's words and actions have directly caused additional undue harm among affected children due to delayed care and liver damage associated with toxic vitamin A levels from parents using the supplements Kennedy endorsed to try to prevent measles. Doctors for America also highlighted Kennedy's celebration of the mass firing of 10,000 employees across the CDC, FDA, and NIH, stating, his celebration of the firings shows a callous disrespect for the service of thousands of dedicated public servants. His tenure thus far has resulted in the disruption of vaccine and medication safety and approval pathways, the dismantling of essential public health services, and the erosion of food safety. The American Public Health Association echoed these calls for resignation, citing Kennedy's dereliction of duty and warning that his leadership puts vulnerable communities at risk. Recent polling reflects this growing backlash. According to a June 2025 Pew Research Center survey, 43% of Americans say they strongly or somewhat disapprove of how Kennedy is handling his job as HHS Secretary, compared to 36% who approve. Among Democrats, disapproval soars to 72%. Strong disapproval outpaces strong approval by nearly 2-1. Many policy analysts warn that Kennedy's actions could have lasting consequences. Experts told CNBC that by removing independent experts from the CDC's vaccine advisory panel, Kennedy risks appointing individuals who align with his anti-vaccine stance, potentially leading to recommendations that emphasize risks over benefits or render vaccinations optional, discouraging more Americans from getting vaccinated or immunizing their children. Since his purge of the ACIP, Kennedy has named 8 new members to the panel, none of whom have substantial current expertise in vaccines, according to public health advocates. The new appointees have pledged to require definitive safety and efficacy data before endorsing any new vaccine recommendations, but critics worry this signals a panel more skeptical of vaccines and potentially inclined to pursue an anti-vaccine agenda. The potential impact on vaccine manufacturers and the broader pharmaceutical industry is also uncertain. Market observers suggest that Kennedy's overhaul adds unpredictability to the regulatory landscape, potentially affecting companies like Moderna, Merck, Pfizer, and BioNTech. The consequences of Kennedy's actions are already being felt across the country. Vaccination rates in multiple states have dropped sharply following HHS decision to stop funding public immunization campaigns. Schools in several districts are reporting localized outbreaks of measles and pertussis. Poison control centers, which depend on grants for data coordination from HHS, report delays in national response to contaminated food and drug alerts. And with the 2024-2025 flu season coming, there is no national strategy in place to distribute vaccines or conduct surveillance. Kennedy's overhaul has also led to thousands of job losses at HHS, staff cuts that have been challenged in court, with a federal judge temporarily pausing some of the firings. The way staff were fired this spring created chaos. Some found out they had been cut when their badges were deactivated, or when they were told by email to leave the building. FDA labs that monitor the food supply have lost staff, and some inspections have already been delayed or canceled. Scientists working on some of Kennedy's stated priorities, like chronic disease, were fired as well. Kennedy's restructuring of HHS is now official. He has eliminated 10,000 employee positions and consolidated HHS's 28 divisions into 15, with new divisions added. This is on top of the roughly 10,000 HHS employees who left since January, resulting in a total reduction of about 25% of the workforce. The cuts span research, public health, oversight of new drugs and devices, and administration of Medicare and Medicaid. Medical professionals warn this could introduce new uncertainties and requirements for complex procedures affecting patient care and access. Kennedy has also pushed forward with a sweeping deregulation agenda. He has rescinded 4 key guidance documents, including one that included sexual orientation and gender identity as protected classes under the Affordable Care Act, and launched a 60-day public request for information to identify and eliminate more outdated or unnecessary regulations. Kennedy says he wants to maintain regulations that genuinely protect the public, but reduce those that thwart innovation and gum up the system with paperwork. Critics argue this approach could undermine protections for vulnerable populations. Kennedy's Make America Healthy Again movement, or MAHA, has made improving children's health a central focus. Last month, his MAHA Commission released the Make Our Children Healthy Again assessment report, aiming to guide federal efforts to tackle chronic disease among kids. However, the report has come under fire for citing studies that either do not exist or were misinterpreted. The White House has acknowledged these errors, promising to update the report, but maintains confidence in its substance. Meanwhile, scientists warn that Kennedy's push to reduce science spending, including a proposed 40% cut to NIH funding in 2026 and the cancellation of over 1,900 research grants, jeopardizes the goal of improving children's health and could affect an entire generation of both children and scientists. What makes Kennedy's leadership so dangerous, in my view, is not just the policy disruption. It's a deliberate erosion of public trust in science itself. Kennedy recently hosted a now infamous press event in which he swam in the polluted waters of Rock Creek Park in Washington, proclaiming that government scientists had exaggerated the creek's contamination levels to instill public fear. The creek has long been known as a breeding ground for fecal contamination. That stunt, widely ridiculed by public health experts, was not an isolated episode. It was the governing philosophy of this department in action. Distrust experts, dramatize dissent, and elevated personal belief over institutional evidence. Kennedy's supporters frame this as a return of power to the people, but in truth, it's the hollowing out of a professional infrastructure built over decades to protect those very people from preventable harm. Stepping back, Kennedy's tenure is part of a broader transformation of the Republican Party, where executive authority is being used to aggressively reshape institutions according to ideological preferences. He is not moderating his positions in the face of governance realities. He's governing exactly as he warned he would, by purging scientific institutions, freezing funding for research he personally distrusts, and replacing professional consensus with personal conviction. There is room for debate about the proper relationship between government and industry, and about how to make science more transparent and accountable. But Kennedy is not engaged in that debate. He's engaged in a campaign to dismantle trust in the very foundations of public health. Trust in vaccines, trust in science, trust in facts. Critics who hope that Kennedy's most radical positions would be tempered by the realities of governance have been proven wrong. The United States cannot meet 21st century health challenges with 19th century tools and 21st century paranoia. Kennedy's policies are not reforming the system, they are massively destabilizing it. His quackery is placing at risk millions of American lives, and the question now is, how will Congress respond? Kennedy is set to testify before lawmakers for the first time as HHS Secretary, and his massive overhaul is facing legal and political challenges. Democratic attorneys general in 16 states have sued HHS, and the NIH to block the agency from canceling funds. The courts may yet rein in some of Kennedy's most extreme actions, but the damage to public trust and institutional capacity may already be done. On June 23rd, Kennedy met with major health insurers, including United Healthcare, Aetna, Cigna, Humana, Blue Cross Blue Shield, and Kaiser Permanente, securing pledges to simplify prior authorization requirements for medications and healthcare services. While the move is aimed at cutting red tape and accelerating care decisions, critics question whether these reforms will be meaningful in the context of broader agency dysfunction and funding cuts. Let's call a spade a spade. Our national health apparatus is in the hands of a man who is demonstrably at odds with the scientific consensus on public health, and so too is our health and safety. Kennedy's supporters may see this as a bold new direction, but the evidence suggests it's a reckless gamble with American lives. As we look ahead to the next flu season, the next measles outbreak, and the next public health crisis, we have to ask, who will be left to protect us? The professionals who built this system are being purged, silenced, or forced out, and their replacements are being chosen for loyalty to an ideology and not expertise. The blood of those who suffer preventable harm will be on Kennedy's hands and on the hands of those who appointed him. Senator Bill Cassidy of Louisiana cast the deciding vote for Kennedy's confirmation. He said he did so on Kennedy's promise that he would not meddle in vaccine policy. Kennedy lied to Cassidy and to his fellow senators. It is time for Republicans to, for once, do the right thing and impeach, convict, and remove from high office this dangerous man. Thank you for joining me for this episode of America's Fractured Politics. I'm your host, Mark Mansour. If you found this episode insightful, please share it with friends and colleagues. And if you have thoughts or questions, I'd love to hear from you. Until next time, stay informed and stay safe.